Good afternoon, everyone. That's just not gonna get it.
Good afternoon.
Good afternoon.
We're in a much better place. Good afternoon, everyone.
Good
Thank
afternoon.
you. I appreciate everyone being here today. This is our second meeting for January. You're gonna have to bear with me a little bit. Picked up a cold somewhere along the way, but we're gonna work through the agenda as rapidly as we can. The item 2 on the agenda is the invocation. I call on Commissioner Dan Combs if he would lead us in that.
Let us pray. Dear Lord, we thank you for another beautiful day. Lord, we thank you for all the blessings of life, Lord, that you give to us each and every day. Lord, forgive us when we take you so much for granted and don't give you the credit for all the things that we achieve every day in life and health, Lord. And we just pray that we would all draw closer to you. Lord, we just pray now that as we conduct the business of the county and we discuss things with department heads and they tell us what's on their agendas and what's going on, Lord, that we all have the same thing in mind, that whatever is best for Nash County is what we're working for. In your name we pray. Amen.
Amen.
Customary, as all the board members know, for us to formulate our agenda, to have the people go first that make the most money in the room. That's why we generally have our attorney report first. But today, well, actually, I see some attorneys sitting on that side too, Mr. Bat, excuse me. But we are tickled to death today to have numerous people from UNC Nash, and I said that backwards, Nash UNC Healthcare with us today to give the commissioners an update on the things going on in our hospital. I think all of us commissioners certainly realize that things are definitely trended upward at our hospital in many, many ways. 6 or 8 months ago, when some of us met with some of the people at the hospital, we are told that you're going to need the commissioners, Nash commissioners are going to need to give us time. We're not going to fix the things, the problems that we have overnight, and we certainly recognize that. We have a few problems, but if you look at the overall picture, I think we're very, very blessed to have the health care that we have in Nash County, and blessed that it is indeed a Nash County-owned hospital. Just timely, I would like to tell those from the hospital that Saturday morning I got a call about 8 o'clock, which is a little early on a Saturday morning, but and I didn't know the gentleman, but he had something on his mind, and he basically told me that he had to go to the emergency room on Thursday night at 2 o'clock in the morning with a reaction to a medicine he had taken, and his tongue, etc., swelled up, and he had read from time to time some things that there might be some delays in our emergency room, but he just wanted to tell me how positive his experience was that when he went, everybody was wonderful to him. When he got there, he went right in, he was seen. Very, very complimentary of the doctor in the emergency room explaining to him how a medicine that he was taking for 7 years could all of a sudden cause an allergic reaction, even though it never had before. He also explained to me that he went in at 2 o'clock, and at 6 o'clock he was sitting on Falls Road waiting for the hot dog stand to open up, completely cured so he could have the normal breakfast that he liked to have on Friday morning. But I thought that was a very positive call, and I appreciate it. Thank you very much for calling and pointing that out to me. But without lingering any longer, Jim, I'm going to turn it over to you. Jim Lilly, our chairman of our Nash Healthcare Board of Commissioners, and I'll let you introduce the people you have with us and present to us any way you see fit. And again, on behalf of the board, we thank you for being here.
Thank you. Glad to be here. So I'm Jim Lilly. I can stand up, or I can walk around the room, or I can come to the podium, wherever you want.
You do what you feel comfortable with,
I'm
sir.
gonna stay right here, 'cause
That's
I know
fine.
it's all.
Okay.
So we are glad to be here. It has been an eventful year for the hospital. It goes without saying. I've got Dorsey Tobias. She's new to our team. She is head of communication and community outreach, a couple other things for us. Ian Buchanan from UNC is our interim CEO, and he does a number of other things at UNC as well. Some of you met Chris Ellington. He has been our contact point for a while now, and he is president of all affiliate activity plus some other stuff. All those guys wear a lot of hats. Jeffrey Batts is our vice chair Just kind of very briefly, we have, I think, made a lot of steps in the right direction. We've also done a lot of things, I hope, that give you a better sense of where we are and what's going on, starting with Lisa joining our board, and she's been a great addition. We are now providing, I think, regular information from our meetings that hopefully give you a sense and a flavor of what's going on. Your chair and I speak, I would say, on a regular basis. I won't say depends on how much trouble I'm in, but we usually we're doing pretty well. But we've probably spoken 8 or 10 times over the past year to try to keep you apprised of what's going on. So that's really all I'm going to cover. We have some prepared comments, and I think Ian has taken the lead on that. And once we get through that, if you've got some questions, we'll try to answer them, or we'll get back to you with more information if we don't have those answers. So I'll turn it over to Dr. Buchanan.
Thank you, Mr. Lilly, and thank you to Chairman Davis and to all of our commission members here. We're really pleased to be here this afternoon and be able to update you all on everything that's going on with Nash UNC Healthcare. I had anticipated the big room and the big wood paneling and the podium and everything. This is very intimate. This is nice. So Chairman Davis a week or so ago sent an email to Jim, and he had a long list of different things that he asked us to touch on. And I wanted to do that and be respectful of his desire to see a broad variety of information, but I also wanted to be sure that we left time for questions for you all. So what I've handed out, and Dorsey has handed out to you all, is a bullet point sheet that covers a lot of territory, and it aims to be comprehensive, to give you a broad overview of a whole lot of different things that we have going on, but also be concise. And I'm going to keep my remarks brief so that we do have questions. UNC Healthcare organizes its key priorities in terms of what we call pillars, and the first of those is always people. And so I've organized this document accordingly. I think by this point, probably everyone is aware that we've hired Dr. Lee Isley. The board has hired Dr. Lee Isley to be the next permanent CEO of Nash UNC Healthcare. If you've read the write-ups in the paper and that sort of thing, he's just an outstanding individual. We've known him for a number of years. We trust him very much, and he has a great track record of success in a rural North Carolina hospital, not dissimilar to Nash UNC, that faces many of the same challenges. So he's going to be here in April. We're extremely excited about that. To ensure continuity in leadership and to help leverage the knowledge of this community and of this hospital that I've gained during my time here, I'm going to actually be continuing to work with Lee, with the board, with the management team as a management liaison from UNC Healthcare. So I'll be working with Chris and with our board and Lee to make sure that we have good continuity there. So Chairman Davis just mentioned a patient who had a reasonably good experience in our ED at least, and that brings me to patient satisfaction. Patient satisfaction is a core focus of UNC Healthcare. It was the focus of our CEO roundtable a couple months ago, and the message from the CEO of our company is clear. Patient satisfaction is one of the most key things to work on. And that's also a tremendous focus for us here locally at Nash. We are in the process right now of implementing Carolina Care. Carolina Care is a homegrown program, a homegrown paradigm of patient care that has a proven track record of success. We've seen it be incredibly successful in inpatient settings, outpatient settings, emergency departments, ICUs, procedural areas, and across hospitals. The fundamental premise of Carolina Care is that we need to make every single interaction between a staff member and a patient an affirmation that we are not only caring for them, but that we care about them, and that we recognize that they are a person, not a diagnosis, not a medical record number. And whether the interaction is with a physician, a nurse, a food service worker, a housekeeper, or even, God forbid, an administrator, we need to make sure that in every one of those moments, we're affirming to that patient that they are important to us and that we are treating them as a person. Rigorous implementation of Carolina Care at UNC hospitals and at Rex Hospital has led those two organizations to be consistent top quartile performers for years. And we've seen significant improvement at all UNC hospitals that have implemented it. So we're very excited to be rolling that out right now at Nash. That rollout's going to continue over the next several months. And we've already gotten some early patient satisfaction results in the areas that we've rolled it out, and we are starting to see exactly the sort of uptick in scores that I would expect. So everybody's favorite topic is Leapfrog, right? A lot of time and energy has been spent on Leapfrog, both in the community and in our hospital. As everybody knows, we've gone from a D hospital to a C hospital. That's good. What's really good, though, is what underlies that. And that is that we've made real, meaningful improvements in a lot of the areas of our operation and in the outcomes of our patients. Strokes and heart attacks are two of the biggest things that kill people in America. And so one of the core metrics that we have is what is the percentage of patients presenting to our hospital who die after having one of those events. In the past, we have had a rate that's above the national average. Over the last number of months, that has come down through very deliberate effort and partnership between physicians, nurses, and other staff, and we are now below national benchmarks in mortality in those two areas. We've also seen a very impressive decrease in our mortality related to sepsis, which is where you get an infection in your bloodstream. That's one of the biggest killers in hospitals in the United States. We've seen a 20% decrease in recent months. We're approaching the national benchmarks and should trend down toward that. As I said, Chairman Davis gave a very kind comment about our ED. There are a lot of comments that could be made that are not so kind, but let me talk about that for a minute. We have undertaken an extremely deliberative process of improving the process of care in our emergency department. And where we've seen that pay off so far is in what we call our front-end metrics. In other words, from the time a patient comes to the front door of the emergency department until the time a provider makes a decision that the patient either can be sent home or needs to be admitted. And during that period, we've seen dramatic improvements in our metrics. So a couple of the core ones that we follow are the so-called door-to-provider time. So literally from the time you're at the front door until a medical provider sees and evaluates you. The national benchmark for that is to have that accomplished in under 30 minutes. We used to be running way above that. We are now very consistently well below that in the mid-20-minute area. Similarly, another metric is what we call the left without being seen metric. So again, what that measures is you come in, you seek care, you sit down in the waiting room, and you're waiting there so long that you just give up and you walk out. We had been running in the double digits there, 10%, 11% of people coming in were leaving without being seen. We're now consistently right around 1% of patients. The national benchmark standard is between 2 and 3%. So we're not only well below national benchmark, we're actually a leader within UNC healthcare system for our performance in that metric. Now, that's the good. The bad comes after that decision where the physician says, not you can go home, you get the bad news. They say you're going to have to stay. And we still have a tremendous bottleneck from that point where the patient has been admitted on paper, the decision has been made to admit them, and we need to get them into an inpatient bed. Right now, every single bed we have available in our hospital is completely full. We're staffing more beds today than we have in many, many years. So we have over 160 staffed beds, open and full right now across town, or across the county, excuse me. And the principal thing that's driving that is we have
room for increasing?
We have physical capacity. What we don't have is staff.
That's what I'm talking about.
Yes, sir.
Physical capacity.
We do have physical capacity. Yes, sir. And so we still have a greater demand for inpatient beds than we have ability to accept at this point. And as a result, a lot of times patients end up spending much longer in the ED after that admission decision than what we would like. We're working very hard with our physicians, with our care management staff, with our nurses, so that we can get the lengths of stay shorter to an appropriate level. And how do I know what an appropriate level is? Well, there are very well established statistical benchmarks that we can look at, and we say, if a patient has condition X and they have these other things going on with them, we know statistically about how long that patient should be staying. Now that is no good with an individual patient, and I don't want you to think that we come to individual patients and say, sorry, your expected length of stay was 3 days and you stayed 5 days. That's not how it works at all. But when we look at the data in aggregate, it tells us that in aggregate, we have patients that are spending too long in the hospital. And that's not good for that patient, it's not good for the next patient who's waiting in the ED, and it's hard on our staff. So we're working very hard on that, and we will make progress. Chairman Davis also asked in his email about the status of our Middlesex practice, which everybody's familiar with. That's our primary care practice out in Middlesex. And rather than addressing that singularly, what I wanted to let this group know is that, so we have a number of owned practices around the town and the county, both primary care and specialty practices. And as part of what we're doing to ensure that we're bringing the most value possible to the county and its residents, we're looking at all of those practices from a financial standpoint, operational standpoint, to make sure that we're meeting the mission to the community and that we're being as fiscally responsible as possible with our operations. Our board has been invaluable in that process, particularly having Ms. Barnes on the board, because that makes sure that we're looking at it not only as healthcare providers, but we're really getting that community input and that community perspective as we review those operations. We're also looking very carefully at the performance of our contracted physicians. Now, who are they? We contract principally for physician services in three main areas. Emergency medicine, so those are the doctors who staff the emergency department. Hospitalists, these are the physicians who take care of patients when they're admitted to the hospital if their primary care doctor doesn't come to the hospital to care for them. And a relatively new term even in healthcare is surgicalists. So these are general surgeons who take care of patients who show up at the hospital with an acute surgical issue. Maybe it's an appendix, maybe it's a gallbladder. It needs to be dealt with right away, and they don't have an existing relationship with a surgeon. So we contract for those services with national companies that provide that. We're looking very carefully at those because, again, we want to make sure that we're getting the most value that we can, that we're getting the best service we can. And one of the other things we're doing is seeing if there are opportunities to partner with providers in Nash County to provide some of those services. One of the things that we've got a great renewed focus on is keeping business and keeping money local. And so that's something that we're going to be continuing to look at very carefully. Getting to finance. There have been a number of comments in the paper and elsewhere saying that the hospital is losing money very rapidly, that we're in financial peril. That characterization is simply not accurate, and it's important that this group understand that it's not accurate. The margin of our hospital consists of two principal parts. First is our so-called operating margin. That's the money that we make by taking care of patients. The second piece is our non-operating margin. That's what we make off of our investments. And it's only by taking the two of those together that you get a complete financial picture of where the hospital stands. So we do have currently a negative operating margin, meaning that we are not making money through the care of patients. We'll get to that in a minute. But that's more than offset by very strong returns from our investments. And so our total margin is positive. We are making money. At the same time, we have to work a very aggressive improvement plan so that we get to the point where we have positive operating margins, where we are making money by taking care of patients. That's something that we have a number of initiatives in place. We are making progress toward, and we anticipate being in a state of having a favorable operating margin by fiscal year 2020. In terms of capital, as you all I hope know, we just opened the Danny Talbot Cancer Center. That's named for Rocky Mount native, football star, and cancer survivor Danny Talbot. The opening of that center concludes a 10-year carefully planned capital improvement initiative. At this time, we don't have any plans for any other substantial building projects. Now, that being said, we will continue with our routine refurbishments, replacements, and renovations to make sure that our facilities are safe, functional, and pleasant for our patients, our physicians, and our staff. We are well underway with implementing the EPIC electronic health record system. That is UNC Healthcare's electronic health record, as well as the record used by most of the other large health systems in the state. That will bring a number of improvements in patient care, efficiency, and financial performance. And in addition, through our partnership with UNC, Nash is going to be one of only 13 hospitals in the entire country that will have achieved the highest level of electronic health record implementation and integration. So that's exciting. Chairman Davis asked about our relationships with physicians in the communities. I'm very pleased with the progress that we've made there, particularly with our relationship with the Boyce Willis Clinic. I want to publicly thank everyone involved with the Boyce Willis Clinic and especially Dr. Martha Chestnut and Dr. Mike Holland. They've really shown a tremendous sense of collaboration and spirit of collaboration. We've already got a couple of active clinical partnerships with them. So we've got partnerships in cardiology and also in ED case management. And we are very actively speaking with them about other partnerships that we can have. And I think at least a few of those will come to fruition and will be really good for the hospital, really good for Boyce Willis, and most of all, very good for this community. So that concludes my remarks, and I will be happy to take questions from the commissioners.
Ian, I don't know where you purposely did it, but I made a couple of notes on bullet points that you had here but didn't bring up. Did you skip those intentionally?
I skipped them just because I wanted to be sure that we had time for questions.
Oh,
I'm
okay.
happy to address any of them that you'd like to delve into.
Well, the first one was the employee compensation comments that you had here. I think we would like to hear basically what you said here.
Yeah, absolutely. So one of the biggest challenges that we have right now at Nash is the recruitment and retention of nurses. There are other groups as well, but nurses are the biggest challenge. And so we've worked with UNC Healthcare Compensation and Nursing Employment to essentially look at where we are relative to our market. And our market, whether we like it or not for nurses, is principally Wake County. And as it turns out, we've fallen pretty significantly behind the market rate for nursing pay. And so we're going to continue to be very challenged unless and until we make adjustments to that nursing compensation so that we can keep people from leaving Nash County to go work in Wake County and spend their money in Wake County. If we don't continue to invest in people, we're going to get even further behind the eight ball. And so at this point, I think that the best thing we can do is bring a very serious proposal to adjust compensation to our board, which we're prepared to do in the next month or so.
And the second one, Dr. Kennedy, was the coastal plain performance, because that's one item I know.
The what, sir? I'm sorry?
The coastal plain.
Yes, sir.
Itself, I know that's one item that we all are concerned about in our community
Yes.
at the present time.
And we're extremely concerned as well, frankly. So, again, Commissioner Barnes has been extremely helpful as a liaison, not only between this body, but between sort of the larger mental health infrastructure in the area and our hospital. So, right now, Coastal Plain is in a very challenging position. The Centers for Medicare and Medicaid Services, which is what regulates all of healthcare, they make the rules. It's called the Golden Rule. They have all the gold, so they make the rules. They changed their rules about the requirements for inpatient psychiatric facilities in the late summer. And that resulted in them coming to our campus and saying, all these things that you guys have in your facility that used to be fine are no longer fine. And it's literally at the level of, they said that our soap dispensers were too firmly affixed to the walls and patients could theoretically hang themselves from them. Okay, so it's serious. We take that type of problem very seriously, but unfortunately what that means is that we've had to have about half the beds in Coastal Plain closed since that time so that those areas can be renovated to meet the newer, more stringent requirements. We've spent about $250,000 on those renovations that should be finished in late February or early March. But more importantly is the programmatic aspects of Coastal Plain. So we've heard very clearly from members of the community that they don't think that Coastal Plain is optimally serving the needs. And in some respects, I agree. And what I mean by that is we've actually seen a dramatic shift in our patient population there. So both the physical facility and the program at Coastal Plain were designed primarily to address patients with mental illness, schizophrenia, severe depression, psychosis, that sort of thing. We're seeing that population remain very stable, but at the same time, it's probably not a surprise to anyone that we're seeing a dramatic increase in our substance abuse population. And many of those patients come in actively detoxing from the substance they're on. They may or may not have a desire to receive therapy at that point. And so we're very concerned that collectively as a community, we're not meeting the needs of that population, and that by the time they get to us, we've already missed the opportunity to meaningfully intervene. So at our next board meeting, we're actually going to have the majority of the board meeting devoted to reviewing the operations of Coastal Plain, the challenges of Coastal Plain, and the opportunities moving forward. And our next step after that is to pull together a group of community stakeholders that includes the FQHC, includes Trillium, includes individual representatives of the community, to talk about, okay, what can we do as a community so that Nash UNC Healthcare can do its part in meeting the mental health and substance abuse crisis, but we're also doing appropriate things in other care venues, not necessarily in inpatient venues, which is not all that effective for substance abuse the way it is for mental health.
Other commissioners have thoughts or comments? Mr. Belfield?
In connection with the image of the hospital healthcare in the community, I know when I was chairman, I met with the CEO and the chairman of your board and suggested they would tell them about a few things that I had been picking up in the community. And I told them that I believe, and they said that that was one of the things that we would look at, that if they would do more public relations. For example, Wake Med, I don't think it's a week that I don't see something on TV about come to Wake Med. Do same thing. And I can't see why we can't do that here. I believe, especially on our local stations here, because they are really listened to, and people watch. So I still say it, and I hope, I haven't seen where there were any changes along that line. And I still say this, and I say, I hope that you will look at, I believe that would help us, because I have been hearing, don't go to Nash Care, Healthcare, go to Wade, go to down to Greenwood. And even, I've even heard some, and I tell you, when I hear them, I disagree with them when they're talking directly with me, because every time I've been going out there ever since it opened for health care, and I've always been treated nice, given the time and everything. So when I hear it, I just speak with them and tell them, I said, now you talking something you heard. And they said, yeah, but why talk something you heard if you don't know it's true? So I just think that there's good public relations will cut a whole lot of that out.
Yes,
And when other people out there hear it, they will say, oh no, I don't believe this is true. But they taking and run with it too.
Dr. Buchanan?
Yeah, thank you for that input, Commissioner. And actually, I'm so glad that Dorsey is here in the room. So Dorsey is our head of external relations for about the last 3-4 months, about that. Many of you know that Dorsey is a Rocky Mount native. She worked in corporate communications with PNC Bank for many years, and external communications is one of her principal areas of focus. One of the things you've already seen is that you're seeing stories in the paper about what we're doing around flu, what we're doing around cardiac care, that sort of thing. We're looking to get the word out about the good things in that way. And I think that as we evolve, the marketing piece becomes more and more important. Now, Wake Med has chosen a very different strategy than most others. They dramatically overspend on marketing. That's one of their strategies. And in fact, if you were to come to Chapel Hill, you could sit down with some of our docs in Chapel Hill and they would say, why doesn't UNC spend what Wake Med does on marketing? So you're in very good company there. But we have a renewed emphasis on ensuring that the community has a clear understanding of what we're doing.
Use all media. The newspaper, it's amazing the number of people not taking the newspaper, but they're watching TV.
Yes, sir.
So I'm seeing your local TV, and I hear a lot of comments about what they've heard on TV.
Yes.
Did you see? I saw you on this program the other night. So I would say utilize your local media, and especially radio and TV.
Point is well
And
taken.
newspaper, yeah.
Thank you.
I think you're doing fine with newspaper, but you're missing a great opportunity with radio and TV.
Well taken, thank you.
Commissioner Combs?
You didn't comment on how the clinic at Middlesex was going, and maybe that was by design. It appears like it's going well. I hear a lot of good comments about that facility, about the doctor over there, and you must be doing something right, because a lot of those nurses and administrative folks in there used to work in Raleigh, and they're back over there. So I hope it's going well, because we'd like to keep it.
It is going well. Those providers are very busy. The patients are very happy. The big challenge with Middlesex is that, to be clear, I don't have any designs to close that clinic or anything else, but the big challenge with it is that it costs the same to operate a clinic in Middlesex as it does to operate it anywhere else. The challenge with Middlesex, of course, is the population is very small, so the total number of people we can touch is low. And most people, after they're seen at that clinic in Middlesex, tend to go to Raleigh if they want higher level care. So they'll go to Wake Med because it's much shorter. You all know that better than I do. So those are the types of things we're looking at in that analysis, but we recognize the importance of ensuring that Nash UNC Healthcare is serving the entire county and not just the Rocky Mount area. And the Middlesex practice is an important component of that overall service.
I hear nothing but good comments about it.
Yes, sir. Thank you. And we do too. Dr. Oligood out there
Yeah,
is
absolutely.
an exceptional provider. We're very fortunate.
You should be able to draw patients from the southern end of Johnston County right there outside of Middlesex. With good service there.
I would like to do that. The data don't show that they're coming, but I'd like to be able to draw those folks
You
for
don't know
sure.
that much about it. That's my opinion.
Yes, sir.
And just make sure, you short timers in our area at the hospital understand that the clinic there is part of an overall goal of this board that we started 10 years ago. For the history of Nash County, when you get to the river, everybody on the other side thinks they are in Wilson County. And we have tried our best. Ms. Barnes has been an advocate of this, as well as Commissioner Combs, to change that image in many ways. We were putting an industrial park down there. The clinic was certainly part of it. We just spend a lot of time in that part of the county. And it's improved, has it not, Ms. Barnes, that they do realize they're in Nash County. So anything you can do to help us continue that trend is the overall picture of 30,000 feet is very important to this board.
I absolutely understand, and actually this is a good time, a good way for me to point out the value that we derive from the local board, from having Mr. Batts, from having Mr. Lilly, from having Mrs. Barnes, because it was less than a month ago that the words out of Jim Lilly's mouth were, we've got to serve the entire county. It can't be about Rocky Mount. It can't be about this area or that area. We need to serve the entire county. And so that's the value that we derive as hospital leaders, as UNC leaders, from this local board, local representation, is getting that very clear input. So we've heard that loud and clear, and we intend to honor that.
Other commissioners, Ms. Wells?
I have good, bad, and ugly.
Oh.
I just want to reverse it.
Okay.
We'll take the good.
Ugly, wait, which one is it? Is this bad or ugly?
Well, I'm gonna give you the bad first. My husband had to go to the emergency room with heart problems.
Yes, ma'am, I'm aware of
All
that.
right. And I guess the ugly is he stayed in the emergency room 26 hours.
Yes, ma'am, he did.
And the thing that kind of, he got excellent service, though, I'll give you that. And he did tell the doctor there, if I had to have surgery, I want it done here. Don't carry me to Wake Med. I want to stay here. And they did, so. But the thing is that I think that bothered me more than anything else is there's got to be a disconnect somehow. We were told after he'd been there like 4 hours, 5 hours, somebody came to the heart unit, that we're going to move him to the heart unit. Well, they finally moved him 20 hours later to the heart unit. And when we got up to the beds, I understand staffing, but it seems to me like he could have been moved. If he's going to the heart unit, it had nothing to do with the hospital being full, beds being full.
Well, I don't know if it did or it didn't, but one thing that I will tell you that we're working very much on is anytime you have a handoff in healthcare, and there are a lot of them, there's a potential for a miscommunication, an issue. And we are now pulling together that hospitalist group who take care of our inpatients and our emergency physician group to make sure that those doctors are communicating effectively with one another. In the past, there's been a tendency sometimes for the ED
I
docs
feel like it got lost
to
in the.
be in the ED.
It got lost in the shuffle.
And that can happen in any hospital. I'm sorry that it happened in the case of your
Well, I
husband.
don't want it to happen to me. I don't want it to happen to nobody.
Exactly
I
right.
don't want anybody to give me anything because I'm a Nash County Commissioner, and I don't think they did, but I want John Paul off the street to be treated just like Talmadge Wells Street.
Yes.
And, you know, that is the thing, the way we're gonna build a hospital, that's everybody together.
Yes.
And I can tell you that since that's happened, I've had more people come to me and tell me how happy they are with the hospital.
Good.
And so I want you to know, you hear the people that are not happy talk all the time, but I think, you know, that we need to hear the people that are happy. But he got excellent service. I find no fault with the people in the emergency room for the way he was treated. Y'all got a man nurse down there that's worth twice what you're paying him, and what you're paying him. But, I mean, he attended
Easy
to us,
now.
and he didn't know us from nobody else. But he really did it. Every so often he'd come in and say, Miss Wells, trying to move him.
Yeah.
But
I
I
thank you for
understand
that
snow
comment.
weekend, but
Yeah,
I mean,
it
I
was a
mean,
little
I
tough.
look at all those things, but it still was not just, I mean, I think that's just too long it's been on the
It,
emergency room.
it was not the experience that we would have wanted you to have. It's not the experience we want any patient to have. I think Chairman Davis, I could have actually not said anything because Chairman Davis actually summed up really the whole story in his comment when he said, we're making progress, things are getting better, it takes time, and I think that
Well,
this
I
is,
understand that, and I'm
I
not,
understand.
it's not that I'm not that upset about his, because you got excellent service.
Yes, ma'am.
It's just that I'm thinking that maybe Janice could be laying next door with him, being worse off than he was, and he was in front of her to be moved. I mean, you know, it's gotta be, I mean, I had a phone call at home at 8 o'clock off the night before and said we're moving in 45 minutes. So the next morning before I went out there, I said, I better call. She said, no ma'am, he's still in the emergency room. So it gets lost sometimes. Dorsey's already heard all of this. It's lost in the shuffle. But everybody out there was really, really nice to us, and I'll give them credit for that. And it wasn't that it's not him that I worry about as much as I worry about somebody else. I want the hospital to make it. That's Nash County, that's us. You don't need to be riding by us to go to Greenville or riding by us to go to Raleigh. You need to be stopping.
I agree. I agree.
I'm off the soapbox now.
Ms. Richardson, I always have to pry you to talk a little bit. Please give us your thoughts.
Well, you know, I could say the same thing, but I had a event with the hospital a little while back, but my family member, good service, no problem. But it was another off-site issue that I still need to, I don't want to do it now, but privately, I need some answers. So if Mr. Lilly or Mr. Bass can talk to me and give me that, I would gladly accept it, but Nash General, I feel like it's just like every other hospital. I've heard those comments, don't take me there. I have been there, my son have been there, other family members. Good service, not perfect, but it's good. So my thing is, if something is not right there, I'm working with you, explain it to you all, let you all work with us on it. But a lot of times people have concerns and they won't talk to the right person to get a good answer. And that's all we are asking is, hey, if you got a problem, talk to the person, let them give you a good answer. Then you can give somebody else a good answer. But if you go with the wrong one and you didn't go to the right person, then we all in trouble, but
I agree, but it's my.
everything is good.
It's my expectation that everyone has to be accountable. I give
Yeah.
my personal cell phone, as the members of our board can attest, my personal cell phone numbers on every one of my communications. It goes to all of our staff, all of our doctors, all of our board members. Mr. Davis has it. I'm happy to give it to you. And you can come to any member of our team and you need to be taken care of.
Well, I still need a few answers, but that's.
I'll give
that's
you my
fine.
card, you give me a call.
All right.
Okay?
Thank you.
Other questions, comments, board members? Mr. Belfield?
One other question, something that came in mind that and if you're doing it, it certainly ought to improve, and that is, what about staff development and each floor, whatever their specialty, do they constantly, well, not necessarily constantly, but do they have staff meetings on each floor when you're changing shifts, or when you're about to change shift?
Yes, sir. So there are, every day whenever the shift changes, the nurses do report with each other. So if I'm the nurse coming off shift and you're coming on, we'll sit down and I'll go through each of our shared patients together. They also have huddles every morning where they talk about the most important things that they're covering that day. But staff development is a challenge right now because we have a large number of nurses who are not permanent employees of Nash. And this gets back to that compensation issue that I was talking about. In order to keep open as many beds as we have open, we have nurses that come from national agencies and come to Nash Hospital. And we're glad to have them. We wouldn't be able to staff the beds without them. However, they come and they go, and it's hard to establish that teamwork. It's hard to establish that culture that we're looking for. So again, that's why investing in the people is so critical for us at this point, because we need to get those temporary staff out of our hospital. We need to keep that money local in our community, in people who live here and work here, and then we can build a culture around those employees.
Ms. Barnes?
I'll just say, it's been an educational year being on the board. Last year, I've learned a whole lot about medical care and the way the hospital is run. So, still learning. I will be still learning, but I think we have a lot to look forward to, and we're on the right track. Got a new CEO. Probably going to be some, and have been some changes made. So, just looking forward to it.
Mr. Outlaw, do you have any thoughts?
Well, I have some thoughts, but I just, I was gonna kind of touch upon door to provider less than 30 minutes, and I'm not looking for a response, but I know you guys are doing everything you can to improve the performance and the quality of service at the hospital, but do you also look at door to room, if a room is necessary? I know you look at that. So that's kind of along what Ms. Wells was talking about.
We do, and that's where I
Yeah.
was saying we still have very significant challenges there. So that's not an area where I'm wanting to trumpet the numbers from the heavens at this point. But
With nurses, I know you've got a shortage of nurses. When a nurse leaves the hospital and goes to Wake County, do you have like an exit survey and you're
Yes.
trying to determine why they're leaving?
Yes.
Okay, so you know if it's money or other reasons?
it's money.
Okay, it's always money?
It's for the ones who go, so out of our nursing workforce, about 10% of our nursing workforce last year left and went to Wake County. Out of those nurses who went to Wake County, it was almost exclusively related to pay.
If you go to Wake Med, what is the nursing compensation at Wake Med in relation to Duke? Would Duke be higher compensation than Wake Med or less?
Duke would be lower. So in general, Wake Med's compensation philosophy has been to be at the top of the market. So to be clear, we are not trying to match Wake Med. UNC Hospitals doesn't match Wake Med, Rex doesn't match Wake Med, Johnston doesn't, and Duke doesn't. However, because Wake Med is so easy for people to get to from Nash County, it's particularly challenging for us. Now, we believe we have a superior work environment, and we believe that if we get closer to being in the right ballpark, that people will choose to stay close to home for their profession and choose to work at our hospital.
What I had heard about Wake Med in relation to Duke is that Wake Med's salary was greater than Duke, but the benefits at Duke outweighed the benefits at Wake, so.
Yeah, when you get into
All
talking.
things even, Duke might be a better fit than Wake.
When you get into talking about total compensation, the picture changes a little bit. The challenge that we have is that particularly for younger nurses, it's very hard to attract a 24-year-old nurse by talking about a retirement plan. It's really easy to talk to them about $2 or $3 or $4 more an hour. And so our HR people are very good at painting a complete total comp picture for our employees, and Nash Healthcare does have a very robust benefit package. It's a strength of being employed there. But particularly for these younger nurses who are so critical to our workforce,
What can you give me now?
quite often it comes down to the hourly
You are
pay.
looking at an overall compensation package.
Yes, sir, yes. And
One more thing I want to ask. It said in here that less than about 1% of the people leave before being seen. So if from door to first touch is less than 30 minutes, do you have any thought as to why people would just up and leave? I mean, decide they want to go to Dunkin' Donuts or
Sometimes.
biscuit or?
Sometimes,
There
so
you go.
it's
Yeah.
important.
They need to be there to start with.
Yeah, I agree.
I mean, I would assume when they come in that they kind of give you their name and some contact
They get
information.
registered, and that's when the clock starts.
Yeah.
And then when they
Do you
separate.
ever have any follow-up with those people to see, why did you just get up? and
Well,
leave?
so the most important driver there, I think, and the key thing to remember is that we have a substantial lack of primary care in this county, in this community. We don't have enough primary care providers. And so even in an era when emergency departments are greatly used for primary care, our emergency department sees a lot more primary care than what you would like to see. So many of these people who are leaving, it may be because they're not really that sick to begin with. Sort of like if you went to your doctor's office, you weren't feeling that good, but then it got too inconvenient, you say, oh, to heck with it. These are not people that have major injuries or major significant illnesses necessarily. It may just be people who are seeking primary
Bit
care.
different from my mindset. But final thing I wanted to ask you was, you said you were kind of maxed out now with your staff at 160 beds. What is the total capacity of the hospital? If you had every bed full and you had the nurses and the staff, what would it be?
Taking all in, it would be around 270 beds. Now, this community doesn't need anything close to 270 beds, and that includes all types of specialty beds. So in other words, that's labor and delivery, and that's critical care. But the issue is that each time we have to bring in one of these agency nurses, those people are incredibly expensive. And so we're trying to balance keeping the emergency department moving, preventing 26-hour waits in the emergency department by opening beds with these premium pay staff, but not filling every bed we possibly could and ending up really in a very difficult financial
So
situation.
you've just got, in essence, space that you don't really need in terms of patients.
Yes, sir, and that's actually on the last page of that sheet I handed out.
What
We're
would you
actually
do with that space then?
We're speaking with local businesses, partner businesses that are in the healthcare space that may wish to lease that space. And that's a way, again, that we can benefit patients, benefit those partner businesses, and also bring some revenue to the hospital.
Well, I tell you, I've heard a lot of good things about Dr. Buchanan, and I appreciate
which-
you. That would be you.
Oh.
And,
We were wondering which doctor.
Yeah, I didn't know there was another one in the county.
I'm talking about this Dr. Buchanan, and I think, me personally, I appreciate your leadership. And of course, we all know Dorsey, and we appreciate the value she brings to the community, and certainly to your chair and your vice chair and the other members of your board. We just thank you for what you're doing to bring the hospital up to where everyone feels like it needs to be.
Thank you, and I'm very appreciative to those same folks. Appreciate it.
It's one thing too, I really like the idea of sending a team into the room, asking the patient all how they like the things and what's going wrong and all these things. I think that's a big improvement, and thank you for doing that.
Thank you. That's a part of the Carolina Care implementation is doing that team rounding.
And they may
yes.
have wished they'd stayed out of that room, but they were very, very nice.
Chairman Lilly?
I was just gonna ask you a 2-minute recap, because it really is significant, because it also affects the other thing that you guys care about a lot, which is community college. Just touch briefly on what we launched this year with the nursing scholarship program.
Yeah, thank you very much.
That's a big deal for us.
We're really excited about this too. So we've partnered with Nash Community College, and Nash Healthcare is essentially sponsoring about a dozen nursing students that are coming through each class year of the community college. And in return for us sponsoring their education, they have, I believe, a 3-year work commitment. Is that a 3-year work commitment to us? So this is sort of the ultimate win-win-win. The community college gets solid funding for these carefully selected students. The hospital gets a pipeline of young, eager, local nurses who are very invested in this community. And the students themselves get essentially a free education in return for this work commitment. So it's a tremendous program. I take no credit for it. Chairman Lilly had an awful lot to do with that program. And unfortunately, the water's not out at the end of the pipe yet. Our first class of students won't be coming out until May. But after that, every year, we're going to have another class, and we're actually also planning to expand that program to Edgecombe Community College and do essentially the same thing there to bulk up those numbers of local nurses who are coming to us each year. Yeah, thank
Don't
you.
rush them out of there too fast, you want them to be ready.
Well, they'll be as ready as a new grad nurse can be, and that's why we have
Well,
senior nurses on our
sometimes,
units.
man, it is not just in medical, man, in everything. Where there's a demand, they tend to rush them, push them on through there, and then they got to do a whole lot of on-the-job training to make sure that
Yes.
they can do the job.
Well, we have an
That's it.
excellent nurse orientation curriculum once they get to the hospital, so I think we'll be in good shape. Thank you.
Well, one final thing I'll say, and I'm gonna shut up, and won't say anything else. I believe in my observation of what I see, and I know I don't see everything in the blue picture, but I think the hospital deserves more than a C. And I have been Wake Med and Duke, and when I go and I take patients up there sometime, and I'm always observing and looking and seeing what kind of care. Only thing I see is they have more resources, but as far as the care that the patients get from the doctors and the nurses and the hospital and all that, I don't see that much difference than what we get out here in Nash healthcare. They just have, like I say, salaries are higher, and they may have more resources, in which they do, but healthcare is just about the same. I don't see any difference.
Thank you, Mr. Bellfield. I probably should ask our staff if you've got any comments or questions, Mr. Lamb.
Yeah, I have one question. For years, counties were involved in home health, and this is probably a good question for you. And over, probably 60, 70 counties had home health units. Now it's down to 20. The commissioners have looked to do an RFP about selling our home health agency.
Preliminary looking into it.
Yeah, preliminarily looking into it, that's right. And I was just wondering, your other 11 hospitals, do any of them manage home health as opposed to the county health department?
Chris Ellington, I'm president of our network hospitals. There's 13 hospitals.
13.
And I go to 13 every month. Some have it, some don't. What's happening with home health and home infusion and durable medical equipment, which is sometimes all lumped together almost, is a big consolidation. So what Medicare has done and what Medicaid and insurance companies have done is not dissimilar. We're seeing our own premiums go up, but yet what is being paid out goes down. It's a lot of regulatory burden. It's difficult. The billing is very difficult for the level of bills that go out. All that aside, what we're seeing is consolidation. So out of those other 13, there are some that still have their own. UNC has one. UNC Rex has a combined entity, and it's of reasonable size, but it's nowhere near the Gentivas, Advanced Home Cares, Kindreds, and those kind of things that have really consolidated these. Medicare also now, you have to bid for certain types of care. If you're going to do oxygen or the CPAPs and those kind of things, and that's making it more difficult. So I think what you're going to see is more consolidation on that side coming up rather than folks starting them up. The hospitals and the healthcare entities that own them now are asking themselves, is that a core part of the business? So if you can sell that to another business and you get as good or better care, and maybe they can do better care because they're spread out more and they have different kinds of resources to spread out, then does that allow you to monetize an asset and then do something over here? So UNC is
whether
going
it's
through the same thing.
County or county-owned hospitals, public nonprofit hospitals, you see it going to private companies?
Yeah, I mean, those could still be public companies, but I don't know that the healthcare entity we're talking about, we always refer to as the hospital, but the conglomerate of that hospital, we're seeing them start to divest those. But just filter out what the data is telling us. Some are selling those because they're saying that everything's consolidated. Many are selling because they want to monetize the asset because they're just trying to stay afloat to the next whatever iteration in healthcare. And so if if you have the opportunity to make a purposeful decision, then you're gonna be a little bit farther ahead of what you wanna do. And if you're selling it, if that adds to the UNC one where we can combine resources, it'll make everybody's cost of care go down, and you don't necessarily have to sell, you could partner before you sell. So you've got, if you're ahead of that, you've got a lot more choices than being behind the 8 ball that you have to sell it to get the cash, in my opinion.
Thank you.
Okay. Other staff members, comments? Seeing none, I'm gonna summarize it very quickly and let you folks get on with what you do best and let us move on. But we, first of all, greatly appreciate the level of people that we have here today in our county building, number one. We asked for an update. I would think in reading our local press, we asked for a financial update, which is not what we did. But I do want to point out that in every time that I have met with any of y'all, Chris, even from the first time that we met, we came with a list of 4 or 5 things that we had concerns about. The financial aspect of it, and Z's gonna keep me under the table, I'm sure, has always been number 5 on that list. It hasn't been by far the most important thing for this board. We are concerned about the financial side of it because we were somewhat used to getting a little money from our county-owned hospital each year that we could help other departments with. But very honestly, that is always going to be at the bottom of this board's list, I think, and we've almost got Z to agree to it, not in public yet, but I do want, I hope that we get the understanding across to our community that those other 4 or 5 things come above the financial side of it. I do think our board is very delighted with who you chose for your new CEO. In reading about this gentleman, and Ms. Barnes has informed us some about him. The fact that he comes from a very similar situation, a county-owned hospital, I think, and understands there are, at some point in the line, a board of commissioners as well that generally gets those calls about complaints from the hospital. I think it's very important to us because he is going to have probably some new insights on that aspect of it that maybe we didn't have before, I'm not sure, but I'm tickled to death because of that. And just overall, we certainly appreciate what you've done the last 14, 15 months since we first come to see you. I do think we all totally agree that things are definitely trending up. I know we're speaking about something y'all working in every day, a very changing society, more stress on our healthcare every day. It's like everything else, you got to do a lot more with a lot less in your reimbursement side of it. But I sincerely believe we're headed in the positive direction and just look forward for the next year to see it continue. Interesting, you said 2020. I can assure you if we are in a positive side by 2020 and all those other 5 things are fixed above that, we just gonna all be very delighted as well as the citizens of Nash County would be. But I do want to thank you for spending the time today. And hope you stick around as long as you can.
Thank you, sir.
Yes,
Appreciate
sir.
it. Thank you. Thank you, everyone.
Yes, sir. Yes, sir, we're glad to come, no problem.
Thank y'all for
Thank you for having us.
Thank you.
Good to see you. Good to meet you. Yes, sir.
You wrote a letter.
The next item on our agenda, moving down to item number 4, is a presentation from Michelle McKnight of the Senior Center and Aging Services. And she has had some health care apparently somewhere recently.
Good afternoon. How is everybody doing?
That's good.
I'm so pleased to be here to be able to share with you all. Now, I know your expectation is pretty high because Commissioner Davis has already said that the folks that make the most money are at the top of the agenda. So let's just bring that bar down just a little. But I'm going to come and share with you some of the great things that are going on right across the street at the Senior Center. So I provided for you, each of you, a packet before the meeting that has a couple of graphs and also has a copy of our most recent newsletter so that when I'm done talking, everyone who is age eligible will come on over and see me and sign up for all of our exciting programs. Well, I'm Michelle McKnight. I'm the Aging Services Director for the county. And just in case you didn't know, we have a very thriving program for seniors, their families, and caregivers here in Nash County. And I would like to just start by giving you a brief overview of some of the things that are going on in the county as far as services and programs that we offer. One of the services that we offer is the Home Delivered Meals Program, and that program provides a hot, nutritious meal to homebound seniors who are not able to get out and grocery shop or prepare meals for themselves. And that program works because we have so many wonderful volunteers who help us to run 11 routes here throughout Nash County. We also have the Congregate Nutrition Program, and that program provides also a hot meal to our seniors actually at the Covenant Home site in Rocky Mount. And there's a hot, nutritious meal that's provided in a group setting, and also usually some sort of activity accompanies that meal, whether it's exercise or a study group or bingo. But the whole purpose is to provide a meal within a group setting. And all of our meals program, we have to meet certain standards in providing those meals. And all those meals have to offer at least 1/3 of your daily nutritional allowance. So at least for that meal during the day, they're getting 1/3 of what they need for the day. We also have a frozen meals program. And the frozen meals are usually given to folks who fall kind of outside of where we have an established route where volunteers deliver meals. But we still want these folks to have access to a nutritional meal. So frozen meals are boxed meals. They're still meant for homebound seniors. Those meals come 5 to a box, and they also meet, each individual meal also meet 1/3 of the daily dietary allowance. We also provide both medical and general transportation services, and we provide these in conjunction with Tar River Transit. And this service allows people to get to their medical appointments on the medical transportation side, and on the general transportation side, it helps to give them a ride over to the senior center so that they can be involved in the social and recreational activities there at the center. We also have the Project Lifesaver program. I believe someone presented not too long ago about Project Lifesaver. But Project Lifesaver is a rapid response program that locates people with brain disorders, whether that's Alzheimer's or other types of dementias, Down syndrome, autism. But these folks are usually prone to wander. So Project Lifesaver outfits our clients with a bracelet that is equipped with a tracking device so that if they do wander away, first responders can locate them quickly before they get injured. And stop me at any point if anyone has any questions. We also have a caregiver support program, and this program is basically meant to surround and envelop a caregiver who is responsible for the care of a loved one or a spouse, mom or dad. Supportive services include the caregiver support group. We provide assistance with nutritional supplements, personal care items, medical assistive equipment, and we provide a wide array of information and referrals, everything from getting help to building a ramp on the front of the house to finding resources that assist with home care. We also provide respite services, and this is another service that's available to our caregivers. And these caregivers can be responsible for the care of an adult or a child. But this family support service can be either a planned respite service or one offered as an emergency temporary placement within a respite facility. So within our building over there, there is a aging services side and there's a senior center side. So I just outlined for you the services that we provide. Now, the senior center side is probably what you hear the most about because we just have fun all the time. Just kind of happens. But within the senior center, we just offer a wide array of recreational activities that range from various holiday socials and seasonal socials, line dance classes, bingo, cooking contests that our friends at the Nash County Sheriff's Office are always so willing to come and be judges for our cooking contest. We have Friday afternoon popcorn and a movie. In the spring, we'll be starting our singles mixers. Our seniors are single and ready to mingle. They have let us know that. So we will be having, yeah, we're going to be having some opportunities for love connections starting in the spring. So I have to let you all know how that goes. We've had a couple of marriages, folks that have met at the senior center and they've gotten married because they've come to the senior center. So we'll see. I may be singing a couple weddings pretty soon. We also have numerous fitness and wellness programs, and that does include a fitness room across the street. We have Tai Chi classes. We offer video and chair aerobics, and we will be starting instructor-led Zumba classes in the spring. We have several health and educational programs, and they're offered through partnerships with our friends that were just here a little while ago with Nash UNC Healthcare. We have had numerous physicians, nurses, nutritionists who have just come. They're always so accommodating to come and provide informational programs for us. So they've been very supportive of our seniors. We've also partnered with the Nash County Sheriff's Office, the Attorney General's Office, and area medical personnel, and our area agency on aging to provide all sorts of educational programs. We also offer arts and crafts programs. We have computer classes. Those are offered in partnership with Nash Community College, and they literally teach you everything from how to turn your computer on to how to get a Microsoft IT literacy certification. I mean, it's from one range of the spectrum to another. And those are provided free of charge to our seniors. We also provide free legal aid services, and that's in partnership with Legal Aid of North Carolina, where an attorney comes to our site once a quarter and schedules a whole day to just see people and answer their legal questions or write wills, advance directives. All those things are provided to them free of charge. We also offer free Medicare insurance counseling. Picking your right Medicare prescription plan can be a very overwhelming and confusing thing, so we have volunteers who come to our center. We also house the Nash County SHIP coordinator in our building, Ms. Morgan Dowdy, who's always available if people walk in and need advice or counseling in relation to their Medicare prescription drug plans. We have a wide array of day and overnight trips that we provide. I think back to the very first trip we ever planned. It was to the Outer Banks, and our assistant county manager, Stacy, and I tackled that trip together. It was an experience. We took that experience and learned from it, and a lot of things we never duplicated again. But since then, we have learned a lot. We came back haggard but wiser from that trip. But we have been everywhere. We've been as local as the Country Doctors Museum in Bailey and as far as the islands of the Eastern Caribbean. So while you all were here getting beat up by Hurricane Matthew, we were sunning out on the deck on Royal Caribbean, the ship there at Royal Caribbean. So we have a very vibrant travel program, which is actually probably one of the biggest reasons our membership has increased so much over the last several years. Because folks want to travel. They want to have fun. They want to enjoy themselves. So we have used travel as a way to increase exposure of our center. And on top of all of that, we also manage over 250 volunteers across all of our programs and services. So never a dull moment over at the Senior Center. We're always doing a lot of interesting things over there. So now that I've given you an overview of what we do as far as programs and services, and that was a very broad overview, I want to give you some numbers that kind of quantify. I'm a numbers girl. I like to compare from one point in time to another how you've grown or what's not working, what's stagnant, what's growing, what do we need to concentrate our efforts. So I've given you a couple of graphs. I'm going to get to those in a minute, but I want to give you some numbers in regards to training. We are very invested in our training efforts in the community, especially when it comes to how emergency medical personnel and law enforcement deal with seniors who may be compromised because of dementia-related disorders. So we have provided training on dementia-related disorders and how to effectively respond in rapid response situations of calls of wandering to over 475 patrol and dispatch personnel, investigators, first responders with the Nash County EMS, the Nash County Sheriff's Office, and the Rocky Mount Police Department. And those are ongoing training efforts. But to date, we've trained over 475 of them. And those are trainings that are done roughly 3 to 4 times a year. So we make sure that that is a partnership that we've established with those agencies to hopefully decrease the number of instances where people may not be appropriately responding to someone who has a brain disorder. We also do several things within our community. Our Easter food drive is one of those things. We do that around Easter time. It's almost time to actually gear up for that again. But we just started that drive about 3 years ago, and that's where we provide a box of non-perishable food items to needy seniors in the county. And to date, we have served 358 families, and we did just start that 3 years ago. But I am encouraged that program is very popular. Actually, it's growing year by year. So we're able to make that work because our community partners help us out with donations and also with deliveries. Our Santa for Seniors program and our Stockings for Seniors programs are both programs that we do during the holiday season. And that's to provide a gift of some sort to seniors in our county. And to date, we have served 818 seniors over the last 5 years through both of those programs. All right, so let's take a look at how we have grown. So I gave you some data to show our growth over the last 5 years, that first graph that's on top there. And on the back of that graph is some explanation of what you'll find on that graph. So for the purposes of this graph, active members are defined as the number of unique individuals who access the senior center for programs or services in a given year. Okay, so we're talking about anybody who walked through our door in the course of that year to access the building for any service or any program. In 2012, we had 1,204 active members. In 2013, that number increased to 1,725 active members. 2014, another increase to 1,912. 2015, we increased to 2,321 members. 2016, we increased to 2,856 active members. And our last year was our highest yet. We currently have 3,418 active memberships at the Senior Center. So what that means is since 2012, our membership has grown by 2,214 seniors. That's a lot. That's a lot, and we feel it, but it's growth that we're very happy about and we're very proud of. But I want to tell you that as the baby boomer population continues to age, the proportion of our older adult population is going to keep increasing. We're not anticipating to see those numbers go down at all. I have another graph to share with you, and it will help put that growth into perspective statewide. And I'm looking at the North Carolina population by age group from 1970 to 2029. So what this graph will show you, and there's also on the back of that graph, there's explanation of what you're seeing. So in 1970, persons aged 60 and older made up 12% of North Carolina's population. In 2000, they increased to 18% of North Carolina's population. By the year 2029, that same age group, persons aged 60 and older, will make up 25% of the population of North Carolina. That's a full quarter. That is incredible growth. And these numbers come from the Division of Aging and Adult Services, and these were their 2016 numbers, so these are fairly recent. Another graph that I have for you is the next one. It shows projected growth of older North Carolinians and the 65 and older and the 85 and older age groups. So in 2000, the number of persons aged 65 and older in North Carolina was 972,417. In 2010, just 10 years later, that number increased to 1.2 million. By 2020, that number is projected to increase to 1.7 million in just 10 years. By 2029, the number of persons aged 65 and older in North Carolina is projected to be 2.2 million individuals. So that is exponential growth, and we have every reason to believe that that trend of growth is going to continue. And it's our responsibility to be prepared as possible for that influx as it's happening, because we see it every day. It's happening. Every time we put out a new trip or a new program, we have a rush of people, new people who are recently retired or they're new to the area, and they're wanting to know what's going on over at the Senior Center. So we're very encouraged by this growth, and we know that with your continued support, we can meet any challenge that we encounter when it comes to this influx of numbers. As we move forward, we may want to consider some expansion, maybe, some adding staff on. I won't harp on that, but we have always had your support, and we are just so happy about that. Many of you are well aware that we're a nationally accredited senior center, and we continue to be only one of 3 in the state who have achieved that honor. And we're committed to continuing that standard and also duplicating and exceeding that standard in our new senior center that's coming in the southern part of the county. We're very excited about that. But we can't take all the credit for that, because it's because we have the support of each and every one of our awesome commissioners that we've been able to keep going forward and doing the things that we've been doing. I've had the pleasure of working with directors from other senior centers in other regions that we're near, and I've seen firsthand what it looks like when they don't have the support of their local government. And I'm very glad to say that I've not had that experience while I've been here in Nash County, and I'm very blessed to be able to say that. So thank you for partnering with us. Thank you for helping us throughout the years, and we are looking forward to continuing to do wonderful and just great things and providing services that just not only meet standards but exceed standards for senior services in the county. Are there any questions?
Any questions from board members, comments?
When you look at the total population of Nash County and of the city of Rocky Mount, they have a senior center.
Mm-hmm.
So you wouldn't be drawing that much from over there. I know you're getting some, but it's not that much. Then they have the Y with all of them basically have some of the same programs, especially physical fitness and healthy lifestyles needed. I think you've done a tremendous job here, the growth that you have. It looks like to me that you're gonna run out of space here in Nashville, because the center down in the southern part of the county would probably take up some of that, cut off some of that. But I appreciate what you're doing and what the department doing, the staff. I have not heard not one negative comment about the senior center.
Thank you. Our goal is to run out of space. That's my goal.
Other thoughts?
If you look at, Michelle, if you look at the active members in 2017, 3,418, do you know what number would be from the southern part of the county, which would end up being there when that center is built versus here? Do you have any idea what that is?
I have access to those numbers. I could get them for you, but I don't have them right now.
Okay. And you comment about trips. I think you exactly dead on. I think that's why you've seen your membership increase so much. But maybe even more important than that is simply because you are such an awesome leader for that group. And I go over there once in a while. I don't go every week, I don't go every month, but every time I go, you're doing something that's fun. The people know it, they recognize it, And you're just an awesome person. I appreciate what
Thank
you
you.
do over there. You're
I
really
appreciate
doing a
that.
great job.
And just to comment on wanting the numbers about in the southern part of the county, what I've come to find out is that even folks who don't directly access our program at Mount Pleasant, there are so many senior groups in the areas. There's so many churches who have these pockets of seniors who are doing programs or who are having activities. And none of them have a central place to meet. I'm doing a presentation at the Bailey Methodist Church next week, and we have been doing these presentations for years now. I bet you there's probably 15 different groups of seniors in that area who have anywhere from 20 to 60 people in their groups. So, and they're all very excited when we bring them information about this new senior center that's coming. So I'm very encouraged by that, and I know that center will be utilized.
When that center is up and running, I believe in 5 years, your membership will double from what you're seeing right now. That's my projection.
I like your projection.
Particularly if you were involved in it.
Thank you. I had a great teacher.
You did.
Other thoughts, comments?
I want you to let me know how that whole single thing turns out. Keep a graph of that too.
I will. We're gonna lock some doors in the back of the building to make sure no funny business goes on. So.
Have you had a wedding in the senior center yet?
We have not had a wedding in the senior center, but we've
The
had.
day's coming, it sounds like.
We'll see.
Right.
You mean a wedding as a result
Well,
of
the
a
couple,
friendship?
no, I'm talking about actually held in there from
No.
two of the attendants.
We haven't, not yet.
Has any commissioner, one of y'all made a comment, I think you did, Mr. Belfield. Has any of you ever had a complaint about the senior center? I've never had a
I
complaint.
never had, not one.
I hadn't either.
The only complaint I ever heard about the senior center
Won't
was
open it up?
they wish they had traveled. They wish they went on trips. And that's all
Right,
history now.
yeah, okay.
And so now I'll make my comment that I was gonna hold.
I've had one complaint.
But we didn't travel for years because we tried not to duplicate services over there. We didn't want to do anything over there that we knew folks could get elsewhere. We wanted to focus on where the gaps were for the citizens here in Nash County. So they could travel with Wilson County Senior Center, even Rocky Mount, when they came online, started traveling. There's other just little pockets of travel groups. But when Michelle came on board and started her programming with the seniors that she serves over there now, they got pretty demanding about the fact that they didn't care
Right.
where
What
else
they
they could access travel. They wanted to travel with Michelle McKnight, because they knew how organized she was, what a planner she was, and they weren't gonna have it. They wanted a travel group, and that's why we travel now.
And that's very important, especially with these seniors. I know my wife, she deals with it. I mean, they expect quite a bit out of the leader that plans, and it's got to be well planned and well communicated to each individual too.
Michelle, you mentioned that we were one of only 3 in the state.
Yes, sir.
Is Rocky Mount one of those other, or is that one of the 3?
Yes, they are now.
They are now, but
Yes.
that's one of the 3.
Yes.
And I
They
know
got-
y'all got to take some credit for them being as well.
We do.
Because I know they came very close behind you, and I remember the president, you actually brought the gentleman that helped get that to our commission meeting one day a number of years ago.
Right, yes, and
Yeah.
we did, we helped them along the way with that, with their standards that they had to meet, and
Right.
Michelle was a resource for him constantly when phone calls came about what to do next, so.
Well, I know that they do a lot of advertising, the fact that they have 1 of 3 in the state as well, but I didn't know if it was different for counties and municipalities, but it's still all the same.
It-
Wonderful.
We're held by the same standards.
from the southern end of the county, all I hear is good comments about what goes on over there at Mount Pleasant now, and how enthusiastic people are, and how they look forward to it. The only negative thing I hear is they don't believe we're gonna ever build that senior center. But
Well,
I think we're fixing to show it.
Yeah.
Next item on the agenda.
I can't help but think the agenda had to be somewhat orchestrated to have Michelle here as item 4. And the next 1, 2, 3 items on the agenda are all about the Nash, Southern Nash Senior Center. But thank you very much. And I think Mr. Outlaw has summed it up very well, how good a job that this board thinks that you do over there, and we greatly appreciate it. Item number 5, Mike Tolson, you want to start the next 3 items?
I would be glad to. Good afternoon. Janice is passing out to you right now a letter that is a award recommendation letter from the consulting engineer that handled the bid administration for the recently bid Southern Nash Senior Center. I know you guys aren't very excited about this project and don't want to talk about it at all, so we'll just go right through with it. What you have in front of you is we were instructed after the bids were open to meet with the contractor who was the low apparent bidder and do some value engineering with them to try and save money where we could on the project, just simply because it's a good sized project and we want to try and be good stewards of every dollar we spend. What you see on here is a recommendation by James Miller, who was like I said, the consulting engineer who oversaw the bid administration, for awarding the contract in the amount of $975,700 for R&L Builders and Sons out of Battleboro, North Carolina. They were our low apparent bidder. Their bid was, at the day we opened bid, was $994,770, which was what we felt was a fair price, but was, and certainly by market standards, was within keeping with everything we've seen in the area. Just a quick couple of notes on the original estimate for the senior center, which was probably about 2.5 years old when we went out to bid for the project. We estimated that the building was going to be between $730 and $750, just the building. And then the total project would be, we had sort of reserved about $900,000 for the total project. As you all know, 2.5 years has had a lot of change on the construction industry, and the projects are a little more expensive. The demand is a little bit higher out there, and so we feel that the price coming in at $975,000 is very competitive with where the market is today and where increases have been taking other projects. I'm happy to say that R&L is a local builder. It's a trend we've had with quite a few other things, with other projects we've been going through. Like to know and like to see that we are supporting our local contractors and vendors, and investing this money back into the community in order to be able to provide these services. Other than that, one of the major features that you guys may not have seen, or you've seen renderings, I believe, but one of the other contributing factors to the cost of the building difference has been the addition of a portico with a airlock to go into the building, or a porch feature on the site, which we feel makes the entire use of the project a little bit more friendly, a little bit more weather friendly, if you will, as people can be dropped off at the front door, and just trying to make the site more inviting and make it as amenable as we can to the clientele. So with that, I would like to see if I could get a vote for us moving forward to approve this project, and I will begin the contracts and signatures and everything, amassing everything to start getting the contracts in front of the chairman in order to be signed and executed, and we can move forward with the project.
Any questions from board members about these bids? I'll just make one brief comment. It was interesting the other day when we had the meeting with the contractor to try to value engineer quite a bit of it. He came in with a very long list of things, and we could have saved a tremendous amount of money. But I was sitting right here where I'm sitting now, and Stacy was in one of these seats and Michelle was in the other. And a very familiar sight to me was, but I never seen two heads connected together. Everything he'd go through, their heads were doing like this. So I get that at home a lot, but it's only one. And just to see them in unison do this throughout the whole meeting, almost. But I agree with them 100%. The things we didn't take were things that we needed to. And I do believe one of the biggest costs that we added was the drop-off area. Excuse me, and the airlock that we put in. But certainly for that type of citizens that we have in the county, we need to be able to get them out of the car in the building without getting wet. And we need to have it so you don't have a rush of air in the building every time you open the door. But I'm certainly satisfied with the bids. And the contractor that we've got, being in that particular profession myself, and would certainly hope the board would see fit to move forward to it. And at this time, I'd entertain a motion to move forward with the awarding of the contract for the Southern Nash Senior Center.
Mr. Chairman,
Yes, sir.
I make a motion that we award the contract for the Southern Nash Senior Center to R&L Builders.
All right,
second it.
I'm gonna take that motion, being, Mr. Combs is from the, southern part of the county, and a second by Mr. Bellfield. Are there any questions on the motion? All in favor of the motion, let it be known by saying aye. Aye. Any opposed by a like sign. Motion carries. Thank you, Mike.
Thank you.
Next item on the agenda, every time we spend money, as you know, we have to have a project ordinance to legally allow us to spend it. And Ms. Wood?
In anticipation of having the proposal approved, I have updated and amended the capital project ordinance for the Southern Nash Senior Center, changing the construction price and moving some other dollar amounts around based on communication with the committee for the Southern Nash Senior Center. And I'm requesting approval of the amendment number 2 to increase the capital project from $900,000 to $1,200,000.
All right, any questions on those numbers you have on that second sheet? You entertain a motion for approval?
So moved.
Moved by Mr.
Second.
Combs, second by the other Southern Nash Commissioner, Ms. Barnes. Any questions on that motion? All in favor of the motion, let it be known by saying aye. Aye. Any opposed by a like sign. Motion carries. And then the last item concerning this, number 7, would be a budget amendment, Ms. Wood.
In order to have the money available for this capital project ordinance, I have proposed a budget amendment to move $300,000 from fund balance, from the general fund balance transfer to the Southern Nash Senior Center capital project.
As you probably remember, we had already allotted, at the beginning of the year, $900,000 for this project. Actually, probably was in the last year's budget, but moving forward, and therefore we're moving from fund balance $300,000 to balance this out. I'd entertain a motion for approval of that fund transfer.
So moved.
Moved by Mr. Outlaw, second by Ms. Barnes. Any questions on that motion? All in favor, let it be known by saying aye. Aye. Any opposed by a like sign? All right, senior center should be off and running, ladies.
What is the projected startup date for that facility?
I'll let Ms. Tolson answer that.
Startup of the facility,
Actually using it?
I believe it's,
I think we got November on
I think so. I was gonna say, some of that depends on getting contracts signed and everything. Starting construction, we hope next month.
So later this year?
Yes, sir. We hope November, and I can't remember if it's a 6-month or a 9-month, contract, but this year.
I
Have
think it's about
we,
9 months.
I think so too.
Yep.
have we or are we planning to promote the facility through the newspaper, a picture, what it looks like, the services that will potentially be provided to let the people there know what's coming and about when it's coming?
I
I
am
think that'll
certain
help
we
your-
will do that.
Absolutely.
Yeah, maybe
I
get
think
something
we
in the
should let
papers
them
on
finally
it.
believe it's gonna happen.
It's a big deal for the southern part of the county.
Well, and we can even go so far as to get some signs posted out at the site if we,
Maybe
you know,
with
with a
a
rendering
picture
possible.
of it, yeah,
we
the
can
rendering.
certainly work on that. I'll look into getting that started.
Maybe even that town hall and a smaller one in Bailey and Middlesex. Great.
All right, any other questions on that? Now on item number 8, which I'm not sure what it is. Mr. Tolson, I'm gonna turn that over to you, sir. Animal shelter site survey quotes.
Good afternoon again. As you all may know, we have we operate an animal shelter out here off of Womble Road, I believe it is. The office facility that we have out there currently is an older, single-wide mobile building that has been brought in. I'm not sure, I think it was probably 20, 30 years old when they brought it in, and has been in various stages of disrepair just due to the conditions that it was in, and then just the heavy use of the actual office building for storage and other type facilities. We've had several water leaks out there, several different things that have caused just deterioration on that building. The most recent one we had was a fairly good-sized water leak that damaged the floors, and after we fixed it, just doing some assessment on the property, and I requested with the county manager that we look into the idea of beginning evaluation of replacing the office building and building possibly some general storage space that they need out there on site, because the solution was not to continue spending good money to repair an old building that was certainly at the end of its useful life. What we've done is just looked into information that we've got and what the general plan could be. That site out there is very constrained, as in it's tucked into a very small area of usable land due to some floodplain constraints, but also due to a communications tower that has guy wires out there that are sort of up against the building envelope that you could have available to you if you were to put a structure out there. But the idea would be we've had some very good luck with trying to get some pre-engineered buildings to look into possible evaluating a site area on the existing lot that would allow us to possibly go further with evaluating an office building. This request today is an effort to get a site survey of the potential of the parcel out there so that we can assess what usable land there is out on the site. Not to go forward with any kind of study for a building, but to get an assessment of what we have available to us on that site in order to be able to do a space needs study and do a space needs analysis of what is needed out there on the site. So all that being said, I've gone and contacted a local surveyor, asked him how much it would cost to get a building location and a topographic feature location on the site, and just a general property boundary location, a general survey, if you will, of the area so that we can look at how big of an area we have to work with. That being said, the price is $2,075 for that work, and we would get a map that would be generated for us to then turn over to a consultant or design in-house, should we so choose as we go forward, if we decide that site has the room to do what we need. Yes, sir.
Yeah, just for information, this immediately would be for the office space and storage space, but it is on our long-term capital project list to make some repairs or additions to the existing shelter. So this would also give us our parameters for building in the future additional runs for the animals.
So you have the land there that you can't expand.
We've got what we have. I don't know if we can expand, but if we have a survey, once we do the building and the office building and storage space, we'll be able to know what we have in the future as far as expanding the kennel part.
This survey will give us that picture, and it's the first step in starting that evaluation.
Other questions? Z, just out of curiosity, is that not something that dollar amount would have fell into you approving it without bringing it to the board?
We could have found the money elsewhere in the budget, but it's a new initiative, and I just wanted y'all to be aware of it.
Okay, so we don't need to take a vote on it?
Unless there's objection, we'll go forward with it.
Any objection from board members?
Move forward.
Okay, all right.
Thank you,
sir. Next item, number 9, DOT resolution. Nancy Nixon. Thought you left, but you did come back.
I did come back. Over the weekend, I sent out a copy of the resolution and a little packet. I'll send those back around if somebody doesn't have one.
We got it.
You got, everybody got it? Okay. About a week and a half ago, I was contacted by Bobby Liverman with DOT, and Bobby asked how he might get a resolution of support before the commissioners, and I said we would handle that and bring it to you. And this is, what it is, DOT has identified some funds available, and they have some, they have a process where they can do some very small projects, which what they called high-impact, low-cost projects. I believe that generally low cost to DOT is somewhere around $250,000. But for how much you can get done with that, it may not be exactly that amount, but it's by DOT standards a pretty small project. And they've got some resources to be able to do that, and so they were looking for some projects that might fit that category. One of them that they have identified is on South Halifax Road at the entrance to Catch Point Drive. Catch Point Drive serves in Rocky Mount as sort of an outlet to a pretty large residential area that's back in there around Gloucester Road and all around that area. But anyway, they identified this, and what they're looking for is something to alleviate traffic congestion and safety concerns when a left-hand turn is being made coming south from Sunset Avenue and stopping the traffic in order to turn into Catch Point. I did bring an aerial photo. Does everybody know where the project is? Everybody's good? Okay, so it's just between Little Eastonburg and Bethlehem Road, north of Oak Level. It is in Commissioner Outlaw's district. And I can read the resolution, but if you've all have read it, I can pass on reading it if you want to as well.
I think it'd be good to have a turn lane there, where you turn left. Yeah.
Nancy, I don't recall ever being asked to do something like this before. Is it just something like use funding source or something?
I've not heard of it before. Okay. I'm not sure if it's something that's done at the division level or if it's just a new funding source.
Well, I know Catch Point itself is in the city of Rocky Mount.
I asked Bobby if we were the appropriate board actually, or if it should be the city, or if it should be the MPO. Yep. And I think that the Catch Point side of the street is in the city limits, but the other side of the street is in Nash County. So
I guess Rocky Mount would be asked to do it as well then.
I didn't ask Bobby that question, but I would imagine that may be a possibility, that he's also looking for something from the city of Rocky Mount.
From Catch Point down to Bethlehem Road, that's the county, and the city stops it. In fact, it goes on down Catch Point Street there, and then circle back around into Bethlehem, and then in between there, that's county.
There is some pieces in there that are undeveloped, right?
Yeah, that may be the reason why they contacted
Just,
Nash County.
The Catch Point itself is indeed in the city.
Yes, it is.
Yeah, it is.
If you remember to let Bobby know that there is a thoroughfare easement already on Halifax Road of 20 feet on the Catch Point side. I just happen to know that because I developed Catch Point many years ago.
I sure
will.
will.
So he may not know that, and he won't have to purchase right away on that side if he widens out on that side.
Okay.
And I remember distinctly because one of the builders actually put a house foundation in that and had to move the house over after he got it about half built.
Yeah.
I came by there one day and happened to see, I knew that the setback was there and he didn't know it was there, so should have.
Yeah, I think we had one of those on Bethlehem Road too.
Is that house Habitat?
Sir?
Is that house Habitat? I think,
Is that house one?
Living. Without being almost reconstructed completely. It doesn't appear to be in any shape that anybody wants to live in as it is now.
This was actually on the Catch Point side, and it was a new house being built. It was actually one of those duplexes.
Oh, I thought you were talking about widening on there.
I was just pointing out to her that let Bobby know he had a extra right of way on that side, because it may not show up.
Yeah.
Any other questions on it?
I just wanted to mention one thing. of course, today's, you know, this meeting is the first I ever heard about this, but it's something that's needed, for sure. But if you go on down to Bethlehem Road, which Mr. Belfield was alluding to, you got the exact same situation down there.
That's
So
terrible.
what you're doing now is you're opening up that traffic to continue flowing for that left turn and sending it on down to Bethlehem, where it's going to then stop for a left turn there. So maybe mention to DOT that if they've got this pot of money that is designated for things like this, that might be another good spot to consider putting a left turn lane.
Yeah, I actually asked Bobby when I started writing was working on the resolution. I got in my head that it seemed to me like Bethlehem Road was a big, something that had, an area that had the same
It is.
issues. And I called Bobby to be sure that I had heard him right and it was Catch Point and not Bethlehem that they were thinking about.
Both of them have a lot of left turns.
Yeah.
But probably
It may be
Bethlehem
that the
may
project cost
have
is
more
different.
than Catch Point.
I think so, because I travel down that road quite a bit.
Probably issue
Bethlehem
there
is the
was
main
Bethlehem
corridor into the
Road
city.
is where most of I see it holding up the traffic for somebody to turn when the others are coming.
Well, actually,
Going
you
north.
get involved in a creek crossing with that one, and it probably may well run it out of the dollar amount per project that they could do.
Well, you've got flexibility on both sides of the
Right.
road.
Yeah.
That's not the case at Catch Point.
No, not
Because
Catch
you've
Point.
got homes there, but
Right.
down at Bethlehem, you've got space
Yeah.
on both sides, which
Yes,
go
sir.
either way.
But you would have a creek that you
You do on
contend with in
you
that
do on
line.
the right side.
Yeah. Okay, I'd entertain a motion, Mr. Outlaw, to approve the
Yes.
resolution.
I certainly would make that motion.
All right, have a motion to approve the resolution by Commissioner Outlaw, second by Commissioner Belfield. Any questions on the motion? All in favor of the motion?
Mr. Dave,
Yes, ma'am.
no questions on that, but I just have a concern on it. And I have talked to Mr. Outlaw this morning about it, when I saw it on the email. And I have been working with DOT over 2 years in my area.
Right.
Some 2 minor repairs, and we can't get anything done out there. And I cannot see where that would not fall being done. And he had promised me that it would be on the schedule to be done this year. And it's still falling lacking, so that's my concern on it
If
is.
you'll let me know what those are, I'll be glad.
If you would give
I
me,
give them 50-11 time, but I
give me
give
one
them
more
30
opportunity to
yeah.
speak to
Because
DOT.
one is connecting to the school,
Right.
and another's another bad issue. But like I said, it's something kind of minor, but
Sure.
you can't keep going back telling your constituents, no, we can't get it, when they are taxpayers like everybody else.
Wayne, your request was to do what?
Give me one more opportunity to
You gonna
speak
talk to
to
DOT
DOT.
about
I've got a stack of information
Okay.
on this particular item
That she's
that we've
speaking
been
of.
chasing now for
Okay.
actually a couple of years.
Okay.
And I'll let you both know
If anything
at our
I
next
do to
meeting
help
where
them
that
know.
stands.
Okay, very good. All right, I'm down to, I got a motion and a second. Any other comments on the motion? All in favor of the motion, let me know by saying aye. Aye. Any opposed by a like sign? Motion carries. Thank you, Commissioner. Next item on the agenda is item 10, resolution setting sheriff's salary. Lamb, I'm gonna let you explain this one.
Mr. Chair,
Yes.
Yeah.
could we have a 5-minute break?
We can have a 7-minute break, sir.
Yeah.
Give you a little more extra time.
All right, fine.
We were on item number 10, resolution setting sheriff's salary, which is just the thing we do each year prior to a sheriff election the following year. And I'll let Mr. Lamb explain that. I'm sure we can do much better than I can.
Yeah, this is, 4 years ago, this caused some heartache because people didn't really understand what we were doing. But in North Carolina, the requirements for being a sheriff is you must be 21 years old, a resident of the county that you live in, and a new requirement that you not be a felon. That happened about 5 or 10 years ago. So what that means is that anybody can run for sheriff, and what this resolution does is set the salary for the next sheriff at the starting salary for that grade, and then upon election or re-election, then the commissioners can alter or amend it at that time. Obviously, an incumbent sheriff would, 99% of the time, I'm sure, would continue to receive the same salary. However, any new winner of sheriff would, you could then consider the years of service in law enforcement and education and other performance matters to set that salary. This is also used to set the 1% filing fee for the sheriff election. So I would ask y'all, if you have any questions, be glad to answer them. Other than that, I would ask you to adopt this resolution.
Questions about what we're doing here? Everybody remember the last time? Mr. Combs, you got any questions on it?
No, sir.
All right, seeing none, I would entertain a motion for us to approve this resolution.
So moved.
Moved by Ms. Richardson, second by Ms. Wells. Any questions on that motion? All in favor of the motion, let it be known by saying aye. Aye. Any opposed by a like sign. Please, could, make sure all of our local press can understand exactly what we're doing so it wouldn't get reported wrong. I know Amanda's still here, but,
Yeah. Yeah, it got, I don't know if it was reported wrong last time, but we got a lot of phone calls.
well, it could have been reported better.
Yeah,
It's a little bit confusing, and it is confusing what we're doing, but, if you could
Yeah,
maybe just touch base with them.
I'll call, at least one member, if you'll get me, Mark Cohn's number.
Right.
I don't have that, but I'll call, I got the other number.
Amanda, you good with it, know what we're doing?
On the sheriff's
You
salary?
think so?
If not, I'll call you.
Okay. It just can be very confusing to the citizens, and then it could upset our sheriff, and we don't want to upset the sheriff.
No. He understands it.
Yeah, I know,
yeah.
you've touched base with him about it.
This is a starting salary for someone new.
That's correct. That's where they're going,
And that's where they don't
right.
understand.
In lieu of taking this action, which is what happened in Wilson County a few years back, had we not taken this action in a timely manner, if, say, Sheriff Stone chose not to run, or where he'd get defeated by someone that didn't have any law enforcement experience, they would come to work at the same thing he's making with all the experience he has.
Yeah.
So this just gives the commissioners a chance to negotiate any new sheriff's salary. But it has to be done at this point in time of the calendar prior to filing.
Yeah, I understand.
Okay.
I just have to mention that.
All right.
This is what people didn't understand. They're talking about, why are you trying to limit the sheriff? They said, no, this is for a start.
Correct.
It's this in two, what happened?
Mr. Outlaw, on item number 11, I turn the floor over to you, sir.
Okay. Thank you, Mr. Chairman. All right, we're gonna do our commissioner reports, starting with Ms. Richardson in District 1.
Yes, Community Care Board, committee met on last Tuesday, and we visited the Breckenridge, and everything was good. Then we visited Brookdale, and the weather had caused some pipes to freeze and burst, and they had to shift some residents around, but everything was taken care of and being repaired, so everything went good with our visit. We had Miss Lewis, myself, and Mr. Ross, along with Miss Brown, to do those visits, and that was good.
Thank you, Ms. Richardson. District 2, Commissioner Belfield.
I'm gonna start with the farmer's market. We've normally been meeting, the first month of the year to kind of make plans for the year, but I haven't heard anything from, the extension office on that, so, I don't have a report on that one. Juvenile crime prevention, we meet Thursday Thursday morning at 9 o'clock. And Upper Coastal Plain Council of Government, we met last week. I'll talk about a few things here. It was announced through Workforce Development that the governor's initiative on economic development, there's a $2 million pilot project, and it's gonna be piloted in Nash and Halifax County, and it will be through Workforce Development. The executive director of Upper Coastal Plain Council of Government is retiring. Announced that he's retiring July 1, and the job description had not been updated in 20 years, and he wanted to update it. And this salary range is, the board discussed it quite a bit and weren't ready to follow their recommendations, and they've asked that the next full board meeting before they take any action, pro or con. And so that's where we are on that. They set up a nominating committee, and Ms. Wells, you on it, did you know that? Okay.
He told me I was on it.
Yeah, okay. Well, they spread it out where they have someone on the nominating committee from each county, and so there's a total of about each county plus the large municipalities, Rocky Mountain and Wilson.
When did you say Greg was retiring?
July 1, June 1, yeah, he's leaving. And he announced it last fall, mentioned the game. Next thing in connection with the Upper Coastal Plain Council of Government, at our annual banquet in November, Nash County received, along with the other 5 counties and municipalities, from the National Association of Development Organizations, recognizing innovative approaches to regional economic development, and basically through the Brownsfield program. So I'm gonna leave this here for the county. I just accepted it for the county. We also received the audit results from the company that audited the Upper Coastal Plain Council Government. They had no issues. And they presented. Anybody want to see this? I'd be glad to pass it around.
Yeah, I'll take it, give it to the finance office. Have you received it?
And that's it for Upper Coastal Plain Council Government. Tar River Transit. One thing I discussed with the board members, we've been having meetings just when we need to take action on a grant and stuff like that. And I suggested to the board and the executive director that we need some set dates. We have meetings, because I have seen times when it would be 2 of us there and 1 out because of something. So we have now set the Tar River Transit meetings on a quarterly basis. And the first one would be March 8th for the first quarter. And then we move on through the year. We have at least 4 meetings a year. And if we need to call a special meeting for something that need action on before we get to our next regular meeting, we will do that. But we do, and we want to do more than just come and pass resolutions, approve a grant application. We want updates on progress, where we need, if we need to make any changes or anything to improve the transit system, we can do it. So that is my report, I have when the farmer's market meet, and I hope we'll be meeting very soon, and I can give you a report at the next meeting. And the juvenile crime prevention. I will say this, one thing they have done in completing the year of 17, this is the calendar year, that's not the fiscal year. All the agencies that are funded, that's working with the juvenile through the court system, have been monitored, evaluated, and now they are telling them to begin making plans for your new fiscal year budget. And the reason they do that, for one reason, that if they're not getting results, we may advertise for some other agency, because we do have more requests than we have money to, cause we're dealing with about $250,000 for the whole year for, right now, we got 8 agencies that's working with the juveniles. That's it.
Mr. Belfield, just a question on the Tar River Transit. Do you see any change with that system with the startup of the downtown center that they're building? I mean, as far as making that available to different kids and so forth in the community to get there?
That's, I'm glad you mentioned that. That's something that we're gonna be on our next agenda.
Okay, I just wondered.
Yeah.
I figured there'd be a lot of youth activities going
It
on
will,
in there.
and we feel that that transit system will be needed. Mhm.
Okay,
Yeah.
thank you, Mr. Belfield. If you have questions with any
You have any
report, just
questions on
jump in
anything?
and ask them. I'm not gonna call for them every time, but if you
Any
have questions,
questions?
just ask it. Okay? Okay,
Just one, the search to replace Greg, we hadn't done that in 20 years, you say? He's been there 20 years?
Yeah, he's been there, I think 23, it's either 23 or 24. I don't mind telling, let
How
me
would
see.
they, would that be a national search, a state search, or do you know how to be done?
It's supposed to be national search, but we did discuss that a little bit in our meeting last week, that those on the staff were encouraged to apply. Yeah.
Do we
And
have,
there are, I know a couple of department heads that I think, just me personally, I think would fit right in as
Okay.
executive director.
no question.
But they're gonna advertise it nationwide.
thank you, Mr. Belfield. Commissioner 3, Dan?
Health and Human Services Board did meet on Thursday, December the 14th. We approved the minutes of the previous meeting. We had a report from Veteran Services. He noted that they worked with 130 veterans in October, 126 veterans in November. And that's pretty much for one person, so he is looking for a part-time position in Veteran Services. We had a report from Donna Boone from Social Services. Her figures, cases, and expenditures are right on target and about what they were last year. The Health Department has been reaccredited, which is something they just went through, and they have the big thing, the offer's been made for the convenience center site over in your area. I don't know if it's been accepted yet or not. It had to go to the bank and it's looking after the property and.
I can
all that kind of
update you on
stuff.
that.
Has it been? Okay.
They're supposed to have the appraisal done this week.
The bank's
The
having
bank
appraisal. That's
is
right.
getting an
The bank's
appraisal
having an
done,
appraisal
and I talked to both the bank in Detroit and one of the appraisers, and he told me he would have it here this week, I believe.
Question I have, if it comes back appraised at 4,000, they're gonna take 4 instead of 8?
We got an offer of 8.
Is that a question when you ask it, you already know the answer?
Yeah, I do, yeah.
When we offered 4, they
Yeah, they
turned-
summarily rejected it.
How many veterans you said you worked with?
130 in October and 126 in November.
I wonder what that number was 3 years ago for Nash County.
Good question.
I don't know.
Excuse me.
So it's Tyler and one full-time, and with
One
the,
full-time right now.
with
is
the
all right.
activity going on there, he's maybe needs some help.
He's his second full-time person has been out on medical leave, so he's been holding down the fort himself for several months.
Landfill expansion, the bids were open, and I think we've talked about that since then, but the bid was $524,000 from PLT in Wilson, which is $229,000 less than the one that we turned down in July. We spent $50,000 moving yard waste to get it lowered, but Ms. Hill was happy with the bid he got. And the request for proposals has been sent out for home health. And Donna did announce to the board that she's retiring effective March 1st. Ag Advisory Board had a meeting on November the 30th. We approved 4 more applicants for voluntary ag districts. We had some board members that all were reappointed, whose terms were running up, that were reappointed. Office staff update out there, administrative assistant, they've hired a Barbara Monk, new livestock agent, Kelsey Litchenwaller, I think. If y'all don't know how to spell it, I'll do it, but I've met her several times, and she's very nice, and I think she'll do a good job. Family and consumer science agent, they're still looking for somebody for that position. Voluntary ag districts in the county, it is 8,247 acres of land that's included in voluntary ag districts from 2010 to 2016, and there were 655 acres added in 2017 for a total of 8,902 acres that have voluntary ag district designations.
Thank you. Good information. Commissioner Barnes, District 4.
So you've heard from the hospital. Trillia met at the end of November, nothing really to report there. I will say that we will need to appoint a replacement for Donna Boone that's on that board, the central board, the Trillia, and that's all I have to report.
Haven't we been using the social service
Just wait till
divine
replaces Donna, replace that
director
person.
to
Well, Donna was.
fill that
We did,
position?
I mean, she was the first time we appointed her, that director, but I have no problem with her successor.
Is that,
About 9 months ago, when we were headed towards going with Trillium, they offered us 2 spots on the board, and y'all appointed Ms. Barnes, and Ms. Barnes recommended Donna Boone. So she deals with a lot of issues like that.
Well, I would just think the person is replacing Donna, we may want to put them on that board. because they-
We'll bring that back to you when we have a person announced.
Okay. District 5, Nash Community, I have no report. Our next trustees meeting is this evening. The RPO TAC, the last meeting was on January 17th, but it was canceled due to the weather, so our next meeting will be March the 14th. Broadband, the RFP was issued on 12/24, and it's posted on the county website. It's also advertised in the Telegram, the Graphic, Spring Hope Enterprise, the News and Observer. Proposal is due to be opened February the 15th at 3 o'clock in the Commissioners' Conference Room. Contract award recommendation planned for March. That's my report. Any questions? Okay, District 6, Commissioner Wells. Ms. Wells.
Attorney for Workforce Development Board is still very, very busy, and they do have grant money. If you know someone that wants to go back into the workplace, they do that. And they had 2 people speak at our last meeting that thanked the board when I'm going to work for the hospital, and Bubby's going to work for someone within the county, not this county, but the county government. STEP's having a planning retreat tomorrow, so have more information on that at next meeting.
And we'll close commissioner reports with District 7, Chairman Davis.
All right, Tourism Development Authority met last Tuesday at 2 o'clock. Meeting was primarily to do a financial update. As you know, we meet twice a year. We also entertained an application for funding at that meeting from the North Carolina Western College, and that request was for a $50,000 grant to match a grant that the college had received to put a walking trail along the entire perimeter of the college. They got a $50,000 grant from, do you recall, Longleaf Foundation, and they needed a partner to match that $50,000 grant. And Dr. Clark had called me about it about 3 months ago, and I asked him could it wait until our regular meeting, and he agreed to do that. But he came, as well as his new grant writer, made a very good presentation. The board considered it and unanimously approved to do that in a 2-payment process. We'll be making a $25,000 payment during the current year that we're in, and we'll be making the second $25,000 payment after July. Budget is approved for TDA.
Is that like a concrete walking?
No, it's actually going to be used also for their new long distance running track.
Okay.
And so it will be similar to what we had talked about, some screenings. It will be 2 miles long, and with that plus the inner track that they got is 2.5 miles, which is the distance they needed to be able to have meets at North Carolina Western College for the long distance runners. So he was pleased that we were able to do that, and it will be open to the public as well. It will have those, he called them something unique, but little blue lights along the trail where if you had an emergency, if you needed help, what did he call those things? Anyway, he had a unique name for them. If you get out there at the college, and you'll see those things located throughout the campus now, as you will with any larger campuses, but you will have those along that trail, and I think it will be utilized quite a bit during the day, particularly from like Honeywell right across the street. He used that in his presentation as well. So we were very pleased to be able to help him with that. The second thing that we took up and got approved was, I think I'd mentioned this board before, that the Travel and Tourism Office, currently located in the third floor of the train station, wanted to move to a more visible spot. So they are relocating as soon as the Capital Broadcasting gets it ready. They'll be moving on to Falls Road in the yellow house that's on the corner right across the street from the brew mill. And we decided, rather than the lease go in Travel and Tourism's name, that we would put it in the TDA name, simply because TDA would allow it to fall under the county's insurance, and Capital Broadcasting has some pretty stringent insurance requirements, as Mr. Durham could let you know, but our board did approve that at that meeting as well. And Vince, I did find out we'd never really had the original to the original lease, and they are preparing that now. And I should have it in the next few days to be able to sign that. We would anticipate hopefully moving in there in the third quarter of this year. I've got a lot of renovations to the house that's got to be done, but the board just felt like that would be a great location with what was going on over there for the Travel and Tourism to be located
Right
at.
on the main road, right on that corner, right?
Right on the main road, yeah.
Right, like that.
A former planning director for City of Rocky Mount bought that house a number of years ago and refurbished it, so it's not in bad shape, but we've got to do quite a bit of rearranging of interior walls to make it work for us, for the, traveling tourism. Moving on down to the MPO, we have not had a meeting since we last met. Our next meeting will be February the 19th at 4:30. And while it's on my mind, that is the same day the commissioners meet, if staff could maybe hold that agenda as short as we could, but get the job done, so maybe I can get over there by 4:30. The Shell building that Dan and I serve on, they did have the pre-construction meeting this past week. As you know, that project was awarded to Smithson here in Rocky Mountain. They are actually supposed to start doing site work this coming week. It has a pretty short time duration for construction, so in 6 months you should see that project completed. Been a long time coming. I'm sure that makes you happy, but you will see construction started on that next week. And then Gold Rock, we had a meeting scheduled in January. January the 22nd, it was canceled. Stacy, I guess due to weather, or was it something else?
The sheriff asked for it to be moved.
Okay.
I think he knew that we didn't make the progress that they had anticipated, and
Okay.
he wanted to push it back.
All right. Anyway, it was canceled, so we have not had a meeting since the last meeting, and it's rescheduled. It's rescheduled till February the 21st. And that's all I had. I'll be glad to answer any questions about those.
Is Smithson, that company, is Smithson himself still operating that company, or just in his name?
Actually, it's in his name. He still works there. He did lose his wife a couple months ago.
I know I hadn't seen him, and I know a good.
He lives in Swansboro, and he.
Good 5 years.
Yeah, he lives down in Swansboro, and he would do just a project every once in a while. They say he comes in and stirs up everything, he gets back in the car, goes back to Swansboro. Knowing him like I do, I'm sure there's probably a description of that. Manny, that's not to be in the press, if you don't mind. But he does have 3 people that actually own it and run it now, in addition to himself. And Sonny Foster, who we all know, being one of them.
Felt like that may be the thing, because I haven't seen him in such a long time now.
He's pretty low key.
Disappeared.
Mr. Outlaw, you.
Back to you, Mr. Chairman.
Okay. All right, that concludes our open session agenda. At this time, I'm gonna call for us to go into closed session to consult with the attorney about employed or retaining a public body in order to preserve the attorney-client privilege, to discuss matters related to focal and expansion of an industry, and to consider conditioned employment of an individual public officer. I would expect an action to be taken in open session on the existing industry, which is not, it's existing industry that we have on, and it will be along the line in meeting an employment goal.
That can't go publicly.
What now?
That's for closed session only.
Right, but I was told that we had to handle it in open session, so y'all discuss it,
We
let me
keep
know.
it up even after we,
No, not until Commerce
Okay,
accepts
okay.
what we're proposing.
that's fine.
We will have to take it up at a later open session,
Correct.
is that what you're saying?
Correct.
I stand corrected, Amanda?
My fault, I was confused.
We have a closed session matter as it relates to employment at one of our existing industries that we will be taking public action on once Commerce has been notified of what we're doing.
And Mr. Chairman, I'd also like in closed session to give the board members the final evaluation package for the manager.
Okay, in addition to the items I named, well, actually, I do have consideration condition of employment of an individual public service. We'll be letting the manager know if he,
I'm proud to say he's gonna stay with us.
okay, all right. You already know that, I didn't know that yet. But, entertain a motion for closed session at this time.
So moved.
Moved by Ms.
Second.
Barnes, second by Mr. Bellfield. Any questions on that motion? All in favor of the motion, let it be known by saying aye.
Aye.
Any opposed by like sign? We're now in closed session. We'll take about a 3 or 4 minute pause.